Let us read about chronic sinusitis. Chronic sinusitis is an inflammation of the sinuses that persists for more than 3 weeks in an adult and 2 weeks in a child. Pathophysiology: a narrowing or obstruction in the osteo of the frontal, maxillary, and anterior ethmoid sinuses usually causes chronic sinusitis, preventing adequate drainage to the nasal passages. A blockage that persists for greater than 3 weeks in an adult may occur because of infection, allergy, or structural abnormalities. This results in stagnant of secretions, that is an ideal medium for infection. The organisms that cause chronic sinusitis uh, are the same as the implicated in acute sinusitis. Immunocompromised patients, however, are at increased risk for developing fungal sinusitis. That is, the causative organism for fungal sinusitis is Aspergillus fumigatus. Signs and symptoms. Clinical manifestations of chronic sinusitis include impaired mucociliary clearance and ventilation, cough, because of the thick discharge constantly drips backward into the nasopharynx, chronic hoarseness, chronic headaches in the periorbital area, and facial pain. Fatigue and nasal stuffiness are also common. These symptoms are generally most pronounced on awakening in the morning. Also, patients experience decrease in smell and taste and a fullness in the ears. Diagnostic findings commonly by computed tomography scan and of the sinus and magnetic resonance imaging, that is MRI, if fungal sinusitis is suspected. So CT scan and another one is MRI. Nasal endoscopy may be indicated to rule out underlying disease such as tumors and sinus mycetomas. Mycetomas is the fungal ball, otherwise called fungal ball. This fungal ball is usually a brown or greenish black material with the consistency of peanut butter or cottage cheese. Complications of sinusitis, although uncommon, include severe orbital cellulitis, subperiosteal abscess, cavernous sinus thrombosis, meningitis, encephalitis, and ischemic infarction. Medical management, usually with antimicrobial agents of choice, include amoxicillin, ampicillin, clarithromycin. Third generation is cephalosporins. Like that. Decongestant agents, antihistamines, saline sprays, heated mist may also provide some symptom relief. Surgical management, when standard medical therapy fails, surgery, usually endoscopic, may be indicated to correct structural deformities that obstruct the ostia, that is openings of the sinus. Excising and cauterizing nasal polyps, correcting a deviated septum, incising and draining the sinuses, aerating the sinuses, and removing tumors are some of the specific procedures performed. When sinusitis is caused by fungal infection, surgery is required to excise the fungal ball and necrotic tissue and drain the sinuses. Oral and topical corticosteroids are usually prescribed. Antimicrobial agents are administered before and after surgery. Some patients with severe chronic sinusitis obtain relief only by moving to the dry climate. Nursing management consists mainly of patient teaching, and the nurse teaches the patient how to promote sinus drainage by increasing the environmental humidity, that is steam bath, hot shower, and facial sauna, increasing fluid intake, applying local heat at hot bed packs, and instruct the patient about the importance of following medication regime. Thank you.